What is the current state of the situation?
We are a cutting edge, but not a bleeding edge system. So we adopt technology very quickly. Um, in the space of artificial intelligence, what we're finding ourselves in is it's being used today in our system without governance or alignment.
Hmm.
And what we've been trying to do is determine where are the appropriate investments, because I think everyone is slapping an AI label based on a tool. In
Mhm.
reality, that doesn't mean that it's truly AI that is, helping complement where we're trying to go as a
Yeah.
system. So we're starting the journey with what are the specific goals of AI? How do we drive the adoption? How do we standardize it? And what does the future look like in healthcare?
Mhm.
And that's a very difficult thing to put our heads around. In more specifics, we are going to try to use AI for three primary use cases within the next 12 to 18 months. So the first is with data and analytics. We are looking to shift from a retro perspective of looking at information to trying to be much more predictive. So building models that allow AI to tell us based on your patient population and the past 3 years of history and current socio and economic status in your area, we project that finances look like this,
Mhm.
census looks like this, and really starting to get away from reacting to what happens weeks after it's already happened and then not being able to make change fast enough. So that's the first. The second is for our clinicians, how does AI allow efficiency and safer patient care? So, with our medical record, with how much time and investment is made with physicians, nurses, et cetera, how do we make their lives easier, but also take that experience and allow it to transform how they do their job to ensure that patient care is ultimately safer? And then the third tool is how do we take AI from a patient experience, and I kind of hate that term. I think we're moving past patient experience and it's more about a consumeristic approach. Like we're competing now for patients, whereas we just tried to treat them well when they were here, but now it's becoming more of a consumer model. But how does AI benefit their lives as far as payment, interacting with a physician? Can we stand AI in front of some of the normal practices of healthcare for the patient that allow our teams to be, again, more efficient, but also allow that patient experience to say, hey, I need a refill on a prescription, and I don't want to wait 2 days before a doctor can get to that note because they're full in clinic. So that's kind of the threefold, if you will:
Mhm.
data, internal operations, external opportunity with patients. And I will say we're kicking off some initiatives, but really clamoring for information and data that'll help us kind of carve the right path forward. Heather, how'd I
Okay.
do?
That was great. The only thing I would say, as you kind of like pull the article together, is where Jamie said consumerism. I do think that is the term we're trying to use in the system right now is the human experience. And so
Mhm.
really trying to take patient viewpoint with employee viewpoint with physician viewpoint, kind of all wrapped into one. So Jamie, if you're okay with that slight tweak, I
Yeah,
think the human experience.
yeah, I like that.
Yeah, good.
Okay. Tell me a little bit more. So let's go dive a little bit deeper into number two for clinicians. So I've definitely seen, I've worked with a number of health systems to help them integrate generative AI, and I've seen generative AI, analytical AI. I've seen resistance from clinicians in a number of areas who are used to their current processes, who are comfortable with them, and there is some concern about job loss and displacement. So what have you seen around clinicians adopting AI tools?
So we are actually getting ready to test our first pilot, and this tool is a language learning model. So what it will do is typically with the medical record, there were simple dictation tools that allow me to click through and put certain information in the right place. The first tool that we're looking to adopt is with Microsoft's Copilot,
Mhm.
utilizing DAX that would allow templates to be set up. So when I enter the room, I could use key phrases that let me transition to a more conversational model, ambient listening that would start to fill out that note and allow me simply to go back and validate that the conversation was captured appropriately. And the goal there is fewfold. First, I want to get the clinician away from the keyboard. Let's have that face-to-face conversation instead of, okay, Dr. Gleb, how are you
Mhm.
today? So that's kind of the first thing. The second is I want that patient interaction to feel very warm and friendly and conversational to the aspect that you are the center of our attention and our focus, not just filling out the sheet to say that you were here.
Mhm.
And then the third piece, again, kind of goes back to that efficiency is how easy can we make that solution where the documentation is appropriate and it's not, you know, a word cloud or word spaghetti that is just let me cover all my bases, but we're keeping appropriate, concise information in the record that would allow a better experience for the provider and also the patient, and ensure that the information that's communicated both ways is clear. So that's kind of our first foray into AI. The second would be with Epic. How do we now start to catch medical errors with some of the tools that they're promoting to say, hey, this dosage looks outside of scope. Did you accidentally fat finger 10 milligrams instead of one? So something to that effect. And I know that's on the journey with Epic. So we're starting with the language and ambient listening. And then eventually we'd like to start to complement tools with physicians that would allow them to offer safer care. Adoption so far with the pilot and the test group and what we've shown has been really good. Um, and we have a 90-day plan of kind of assessing this with a goal of finishing that up in May of this year and starting implementation of those new tools in the summer.
Tell me a little bit more about the pilot. What did you do to prepare the ground for it to make sure it went well? How did you think it through? What did you do to address things like potential employee resistance and concerns about this tool? What was your approach to that? So, like just starting, how did you plan it out?
That's great. So the first was to talk through barriers. So we started assessing, if I could fix one thing from a provider perspective, what would that be? And the consistent response there was we just spend too much time in the medical record, clicking and typing and dictation is great, but it's not always perfect. And so that really started the conversation. So we went to our partners at Ohio State. We talked to some other health systems. We talked to some vendors, Oracle, Microsoft, you name it, all the big ones. And we started to see what folks were doing in this space. Epic and Microsoft announced a partnership last year that made this advantageous for the DAX Copilot. Excuse me.
Mhm.
And so that really kicked off the conversation of, okay, this is one solution. Let's have them do a demonstration and let's take away what's good there and what's bad. Then when we had that information, we said, well, there's other tools out there. HCA had launched a partnership with Augmetics for a similar type dictation, augmented dictation, if you will. And so we brought those two solutions together. We built our requirements of what success looks like. Then we started through all of the agreements and the planning and the testing. We got that number to about 20 physicians, which I'm really happy with. And that's a mixture of specialty, primary care, inpatient. And they're going to fill out a very specific testing script over those 90 days with weekly feedback to let us assess the before and after. We've also built the data and analytics through Signal within Epic that tells us, did clicks go down? Did time in the medical record go down for those that were on this pilot? So that way, it's not just a feelings meeting. Did we make a meaningful impact to return time to their day? So I hope that was a good overview, but that's kind of, we wanted to be very data focused in that we could measure the outcome and not just anticipate based off of what someone thought or felt.
Why did you choose this approach in particular of looking at medical records and filling them in? Do you think it's because it was the easiest one to start with? Like, what was your strategy? Or kind of like what was your thinking in you choosing this specific project among a number that you could have chosen?
Their feedback. So I meet with the providers weekly,
Mhm.
a group of providers, and then different committees once a month. Their feedback was the initial, if
Mhm.
I saw one problem. The second was we get our quarterly Epic report, and when we see the signal data, we're missing on about 6 of the 10 metrics that are being driven by really advanced healthcare systems. And
Mhm.
so our clicks are high, our time in the record is high, our time for chart closure is high. So from a KPI perspective, their feedback, and then how do we validate, oh, we do have a problem here. And then this seems to be not necessarily the low-hanging fruit, but a 10% return on the physician perspective here would yield for them close to an hour a day, and giving back
Mhm.
5 hours a week to a physician over the course of the year. My hope is that we remove some of the burnout. We get away from feeling like you have to be connected at all times. We turn patient results and information around faster, which means the patient experience for access, medications, getting the help they need is faster. So it really started with their conversation backed in data, but also the Epic, just the signal information is really for a couple of quarters, I was like, man, we're not making progress here from a provider efficiency perspective.
Mhm. Mhm. And so, what has the pilot been showing so far? So, you have some initial results from presumably you're tracking it, the physicians filling it out weekly, also looking at their analytics. What are you seeing so far?
It's very early. So we've had
Yeah.
4 folks adopt. We haven't got our first round of feedback. We literally just
Got it.
started, and
Oh,
everyone
cool.
is going live 2 weeks. So
Nice.
we'll have the full complement, and our first assessment is due back the week of March 10th. So that's the first
Mhm.
time we're going to gather information. So very early on in that part of the journey, but
Mhm.
the only feedback we've received to this point is they like the integrations with Haiku. There seems to be an educational barrier on how to use it and when
Mhm.
to use it. So that's a very recent update that I don't know that I have an answer for just yet.
So something I've seen with other when I was working with some other health systems that integrated generative AI is that they talked to practitioners who are already using generative AI in their personal life and try to figure out how to adopt so and we're already using it in their medical work to do some reporting and compliance and so on. And they looked at some of these early generative AI champions who were already using it in their work, and they tried to figure out some use cases based on, hey, what are people already doing right now? And not simply with practitioners, but also with back office staff who work a lot with documents and compliance and reporting. I'm curious if you've thought about something like that, of doing a broad survey and seeing where people might already be using it and where they think they might be helpful, and then using that as a basis to develop some use cases.
That's really good. I will say, and I don't know if you're aware of this, we have a Epic Community Connect partnership with Ohio State. And so they become, in a lot of conversations, our go-to from the setup, integration, all of that. So we have spent a good bit of time with their physicians talking through their benefits and uses. And just being completely transparent, one of the challenges I have with that it gives a very narrow focus to only how Ohio State is using it. And where that's a fine line is with other health systems that we speak of with Epic. There have been times we come back with ways that we would like to do something that Ohio State can't be responsive to because they provide the record to a larger group.
Mhm. Mhm. Okay, I see what you're saying about the restrictions. Let's talk a little bit more about other risks that you're seeing. What kind of risks are you anticipating? I mean, obviously there's the challenge of will the data be accurate? The issues around bias. So tell me a little bit more about risks and how you're anticipating them and what you're doing to address them.
No, that's good. So we are actually standing up an AI governance council, simply because from a compliance, legal, operation perspective, um, I'm not sure that we have wide enough oversight outside of me providing a technology. So that's a piece.
Mhm.
Second is I'm really worried about standardization. So how are we ensuring that the providers know how to use the tool, but also that they are using that in the parameters that we've prescribed? And then how are we allowing the physician's voice to champion that component? Because if I say that from an IT perspective, I'm probably going to be a little bit more loose and say, just
Yeah.
use it. Compliance is going to have very different expectations on how the medical record's filled out. So I think that standardization and education are big. The third piece, and this is a tough one, and Heather's heard this story probably 12 times, so I'm sorry, Heather. In Appalachia, there's a tremendous challenge with adoption of technology and it not feeling threatening. And so
Right.
there's still some providers that I have that use old dictation phones and we keep a system up
Mm.
because they don't trust technology. And when we had McDonald's put in like the kiosks where you touch, they were picketed here in
Yeah.
Philadelphia. So that is sometimes what we run into is there is a cultural uh, influence here that,
Mhm.
in IT, I'm like, oh, they already have your data anyway, so let's just go. But from a physician perspective, there's been some trepidation around, hey, how do I ensure that my data is safe, my patient's data is safe, that this can't be used against me in a court of law? Like, there's kind of that safety net, not true cybersecurity, but I don't know that I want a tool listening to me all the time because what if I say something wrong?
Mhm. Yeah.
So that's probably the other outlier that isn't
Mhm.
operational or patient facing that I'm worried we'll have physicians that opt out of something that could help them because they're just untrusting of advances in technology, period.
I would say if Jamie, if I could add, we're kind of in a little bit of a conundrum because while we do have that Appalachia culture with our more seasoned physicians, our newer physicians that come out of practice that want the innovation. And so it's trying to find that balance between generations, really. Don't you think, Jamie, that's part of it too? Because we get some out of residency and fellowships that, are very advanced in the technology space. And so it's trying to create solutions that work for all of our workforce. Is that fair, Jamie?
I 100% agree.
Yeah.
So what do you anticipate? And I've definitely seen this happen when I worked with some health systems that you have differentiated uptake of some people, especially younger people who are more digitally comfortable and savvy. They are much more comfortable with adopting these tools. And so they adopt generative AI tools in a variety of settings, whether the kind of listening notes, the medical guardrails, even medical decision-making tools like radiology. I mean, I'm sure you've seen the extensive studies showing that radiology exams are very effectively done with generative AI tools and AI analytics tools. And then some radiologists don't want to use it because they're very old school. And so you have differentiated uptakes. And obviously, it's not great for patient safety if radiologists are not using tools that improve their safety abilities. So I'm curious, and I can share about what others do, but I'm curious about what you're anticipating around this issue.
Well, um, this is where for a technologist, I feel I'm very personable and I know
Mhm.
technology, which is not typical, but I also know my adoption and acceptance of it is at a different pace than most. Um, the purpose of AI in most cases is to augment intelligence and reduce the need for staff in certain
Mhm.
capacities. Now, I like to say we'll reutilize staff for other areas, right? But the truth is most companies are entering into AI to try to cut costs in some manner and reduce workforce errors. And that could and most likely will have a workforce impact. And to be fair, I don't know how to tackle that one yet. From a this I know this will change jobs and it will
Mhm.
change what some people do. Um, it's kind of like, the localized accountant before QuickBooks.
Yeah.
So it's very difficult that I can't go in and say that this isn't going to impact people's livelihood. I know that's a
Mhm.
question that happens. And so I think that's a journey for Heather and I from the HR perspective is, what is fair and appropriate use of system resources, but also understanding that, healthcare is complex and medical errors are what lead to the most complex issues, whether those are health-based, financial, data, all the above. And I don't have a good answer for that one. And I'm willing to admit when I don't know something and I don't know how to tell people in a localized area, yeah, if I do this right, we should need less people to do certain functions. And I've been asked that question. I'm a very transparent person that, yeah, this is going to impact the way we do business. Um, but I don't know that anyone in the industry truly has a good idea of what exactly that looks like and how the future of healthcare will forever be changed. But it is something I'm very well aware of as a concern.
Yeah.
Sorry, that was a great question.
No, I mean, it's an important question to address. Heather, I presume you have some insights on this.
Yeah, I mean, I think that what Jamie said is true. The one thing that we've always said is as we think about our people strategy, that we're always innovating to say, well, maybe it's not this role that you're used to, but maybe it's that role. And
Mhm.
so I do think that there's opportunities to reskill, retool people and shift them, not necessarily eliminating. I mean, we do that all the time when we think about making sure people work to the top of their license. So, are there things that physicians are doing that a nurse can do? Are there things nurses are
Mhm.
doing that an LPN can do or an MA can do? So, I do think that that plays into it. Don't you agree, Jamie? And
Yeah.
we might
What?
need more people in IT or
Mhm.
in data management. I mean, those might be different roles that we have to build out a little bit further. And to Jamie's point, even on the governance side, just so that we don't have the Wild West going on.
Mhm. Yeah, what I've seen work well with other health systems that I've worked with is two elements, and just kind of thinking about this is one is to really focus on the patient care, saying you're not trying to eliminate jobs, you're focusing on efficient patient care, and everything else follows, which I'm sure you'll be doing anyway. But that is, I think, a really fundamental message that it's all coming from patient care and the most effective, safe, efficient patient care. You're not trying to eliminate jobs because a number of people are worried that you're trying to eliminate jobs. So that's not what you're trying to do.
Yeah.
So it's all coming from patient care. That's one. And the second is to talk about how it's the people your job will be safe if you learn how to use AI effectively, generative AI effectively. Like your job will be very safe. And so that helps get over people's resistance and helps them see that, hey, it's in your hands, whatever happens. And having messaging around this, I find has been helpful for people to get that people who are in the middle, you'll still have some very old school folks who are completely resistant. Then you have some people who are excited about adopting it, but you have lots of people who are in the middle, and those are the people who you can shift.
Yeah. No, I totally agree. And it really, I think, is a parallel to when we went to the medical record, right? People were used to doing
Mhm.
paper, and some people chose to retire at that time because they didn't want to make the transition. And so I do think this is another evolution of that space too. So I do think there's probably some learnings from when the industry transitioned to the
Mhm.
electronic health record from paper. And that was a trying time for some of the workforce as well, because they thought the same thing, like our jobs are being eliminated. No, they're not being eliminated. More efficient, more safe, better interactions with the patients, better availability for patients to see their medical records. So I do think we can learn something from that too.
Okay. Now, as we wrap up, what are your thoughts about the adoption of AI going forward? You've already started this project, it's in the process. We've had these conversations and you're having these conversations. What's your vision for how Adena Health systems will be different in 5 years from now with the use of AI?
So nirvana, we use that term here to describe what we'd like to see in the future.
Yeah.
Nirvana is, for me, not necessarily just saying that I have a technology, but having a meaningful implementation that has impacted the well-being, and I use that term broadly, the well-being of everyone, included. And I would love to see providers who are working a full day not having dinner with the kids and then immediately having to grab their laptop to try to finish the day. I would like to see patients interacting with an AI environment that serves as an extension of Adena that allows them to get their requests fulfilled faster, easier, and gives them a better picture of their healthcare. I mean, we haven't even gone into the perspective of wearables and trended health analytics and what that means from my overall well-being. I have a scale that, I've used as I've lost quite a bit of weight over the last 6 months or so. And
Hmm.
that scale's ability to tell me how my organs have been impacted, what health looks like for the future. I would like to see AI going along in that journey with the well-being of the patient and the doctors and the tool being a complement to the overall well-being of our communities. That's nirvana there. The second would be whatever is manual today in back office function or standard traditional process, that we are continuing to automate those and allowing us to be less focused on the task and more focused on the people. And so while I would love to have all the whiz bangs, I think all technology needs grounded in the benefit that it brings to your local population and community. And I would agree, there's no desire for me to eliminate jobs, but there may be a need or a necessity to eliminate the way that we offer traditional healthcare. Um, and so that would be nirvana to me is uh, a digital workforce that enhances the caregiver team that we have today that makes us one of the best in the industry. I just
Excellent.
came up with digital workforce. I think I'm going to stick with that one.
Yeah,
Good.
that's a good one. We could have
That's
used that
good.
one in the other remote worker article, couldn't
Yeah,
we? That's a good one. It's good.
excellent.
Yeah.
Heather, anything you wish to add to that?
No, I think that's good. I like it.
Okay. Well, thank you very much. Really appreciate your time. That was very helpful. Great conversation.
No, I
Sounds good.
appreciate it very much. It was wonderful to meet you, and I look forward to having additional conversations and feedback with you in the future.
Excellent. All right. Well, thank you all. Have a great
Thank
Thank you.
day.
Bye-bye.
See you.
Bye-bye.